So in this video, we're going to talk about one of the most common symptoms I see in my practice. There is not a day that goes by where a patient does not tell me they have trouble sleeping at nighttime. Insomnia is a condition or it's a symptom, and we're going to get into a particular patient that's going to help you understand how I approach insomnia. Now, insomnia or difficulty sleeping at nighttime is different for every single patient. So I'm going to talk to you about this particular patient, Craig. So Craig is 32 years old. He came to see me recently in the office. He sat down, he was rubbing his eyes and said, I just can't shut my brain off at night. I've never been a good sleeper at night. I just cannot sleep at night. I've tried melatonin. I tried all different strengths of melatonin. I was prescribed alprazolam, Xanax. I was told I have a condition maybe such as general anxiety disorder. I was put on medication, what we call an SSRI, which was Zoloft. That didn't help. I also did not want to take these medications because I am in fear of being addicted. Nothing is working. I am in a need of help. Dr. Resnick, please help me. What I like about one of the things is that he states right there, a lot of the things that he's doing, he's giving me in the history, but he's also telling me, hey, doctor, help me. What can I do to get better? See, that's the key right there. Not doctor, what you're going to prescribe. Doctor, what can I do to get better? That is a good start. And what this video is going to be about is not just treating the condition, that fifth box, that physical health box of insomnia, but it's understanding it. What's going on in that brain of his? What's going on in the mind? Is it making it worse? How his mind is working? And how to finally create a healthy sleep through habit, relaxation, and changing your identity. Those are very important aspects here. So we're going to talk about the 5 pillars of health. Again, for every single patient, we're going to go back to those 5 pillars of health. There's going to be another video that talks about each pillar in more detail. So in the healthy mind and a healthy brain, it directly disrupts your pillar number 4. Sleep is the backbone of all healing. If your sleep is broken, everything suffers. Your memory, your emotions, your energy, your immune system, your mood, even your physical health. So that pillar is so important, it leads to number 5. Though you got to focus on pillar number 1. Education. What is insomnia? Remember, insomnia is a symptom, not a condition. Now, there are different types of parasomnias, like circadian rhythm disorders. There's narcolepsy with cataplexy. We can go on about those. I'm talking about this particular patient. I'm going to have individual videos discussing all the different types of parasomnias. So what I'm hearing is, I can't sleep at night. And what are the questions I want to ask him? Well, what time do you go to bed? What's your routine before you go to bed? Do you nap at night? What time do you wake up? Do you use your phone at night? Are you seeing sunlight in the morning? Why? Because sleep is a habit. Habits come from your subconscious brain, and we're going to talk a lot about habits because I believe that habits are processed in your subconscious mind and brain, and it's wired for efficiency. And if we look at habitual responses and your habitual sleep patterns, then having the appropriate habit will guide you into a physically healthy life and longevity and improvement in your sleep. So you don't think your way into sleep. You create the conditions for your brain and your mind to fall into sleep naturally. But most people do this. They look at that bed and they look at that bed as a challenge. So the minute the nighttime comes, they look at that bed and say, oh my goodness, tonight I'm going to have to go in that bed. How am I going to sleep tonight? I hope I sleep tonight. I have an early meeting tomorrow. I need sleep. I need my brain to be working so well tomorrow. Do I take my melatonin? Do I take my alprazolam? I don't want to be addicted. What if I don't sleep at night? What if I don't function the next day? You're already preloading that brain the minute you see that bed. That is becoming a challenge. Sleep already is a challenge. It's not for relaxation. So you're gone from relaxation to panic, from mindful to brainful. The wired programs over and over again is going through that brain that's hardwired. That sympathetic nervous system is kicking in. Your heart rate is increasing. There's increase in adrenaline. And over time with stress, cortisol. So your brain is thinking that it's solving a problem rather than preparing to sleep. So let's look at this clinically and neurologically. So this is what a neurologist or myself will look at. Look what's happening in the brain. Your sleep is governed by circadian rhythm. It's governed by melatonin production and the balance of these excitatory and inhibitory neurotransmitters. So melatonin isn't a sleeping pill. It's a signal to the brain that it's time to wind down. It's time to sleep. It's preparation. But most people, what they do, and in this particular patient, we overdose on it. We're taking too much melatonin because in the pharmacy, you can see that there's 5 to 10 milligrams of melatonin. So we think that more melatonin will help us sleep better. Believe it or not, synthetic melatonin, 0.2 to less than 1 milligram is sufficient. And we're going to talk about melatonin in a separate video, but I'm talking about this particular patient. So melatonin doesn't sedate. It cues the brain that we're preparing to sleep. And particularly melatonin should be taken 2 to 3 hours prior to sleep. That's the key right there. So sleep occurs in stages: light sleep, deep sleep, REM sleep. Each is very important. Good sleep is about efficiency. It's not just getting those 7 to 8 hours. We want to get sleep without shallow cycles and too many arousals. We want continuous sleep and getting into those stages efficiently. So let's go back to the patient. He's using devices before bed. He's thinking about work. He's worrying about sleep. So the brain isn't looking at the bed as comfort, as relaxation. He's looking at it as a battlefield. So look, think of this. Would you watch a horror movie in a spa? Of course not. So why are you bringing this into the bed? What people are doing to the brain every single night, the brain needs a relaxation ritual. It's not a decision-making crisis. So the key here is pillar number 1 is emotional and brain health. We talked about, and this is the mindset of getting into the bed. So the minute you hit that bed, I need to sleep. No, I get to relax, because once you start preloading and you put more worry into sleep or more pressure into sleep, that creates performance anxiety. You're not an insomniac. You're a human stuck in a brain loop that can be rewired. So we want to shift from I need to sleep towards, hey, I get to relax. I love sleeping. I can't wait to get on that bed. That bed is so relaxing. I want to relax my body. My body deserves sleep. My mind deserves sleep, as opposed to challenging. Once you get into challenging and problem solving and that brain starts going, then that's a problem. Or if you start avoiding using devices about a worry itself, then the brain starts to worry, which we're going to get into a lot about worry. So schedule worry time before bed. So there are times where you can actually say, you know what? We're going to worry on a worry break another time. You can schedule worry breaks, which I talk to my patients about. On a day, you can have three separate sessions of worry breaks that could be 10 to 15 minutes where you can let out your worries. So if you get a worry, you can feel curious about the worry. And why is the worry coming at this time? And say, you know what? I'm going to take that worry and I'm going to file it. I'm going to file that in my file cabinet. And that's what I told the patient. And when the patient came back and told me he was sleeping better, he told me that his file cabinet was full of files. Schedule worry time and file it for later, address it, but don't avoid it. That's the key. Now, deep breathing or progressive muscle relaxation and body scan to calm the vagus nerve is so important. And the visualization, imagining the mind floating downstream. You want to imagine the brain floating down. You want to imagine climbing a mountain. Climbing a mountain is where you're going at if you want to look in that route of a challenge. We're not challenging, we're relaxing. So let's look at what's really happening when your brain and you can't sleep. So first, understand this. The brain doesn't know the difference between a real threat and an imagined one. If your mind is racing and worrying about whether you're asleep or not, it sends that message to your brain, and your brain in turn activates that sympathetic nervous system. Now you become aroused. You got cortisol, you got adrenaline. So what happens? Your heart rate increases. You have more mental activity, not less. You see that? Now, here's the key. Trying to suppress the worry actually makes it louder. So suppressing makes it louder. It's screaming and screaming and screaming. So if you lay in bed thinking, don't think about that meeting or stop stressing, it actually does the opposite. Or do I need to take the pill? Should I take the pill later? Should I take the pill if I wake up? What's going to happen? It's going to be louder. You're going to have difficulty sleeping at night. So you're not silencing the worry. You're putting a spotlight on it and making it louder. It's getting angrier. So again, you have to understand what your brain is doing here. So this is what we call amplification through resistance. The more you try to push it away, the more your brain flags at it as important. So let me say that again. The more you try to push it away, the more your brain flags as if this is important. We need to problem solve. And this is where your brain starts becoming louder in that brainful program. You want to be in that mindful program. So what it does, it flags it or tags this as potential danger. And it keeps those circuits and those networks open in the brain itself. So the brain is built at that moment for survival, not silence. So when you obsess over melatonin and you want to wonder whether you're taking Xanax or you're replaying the fear of addiction, you're reinforcing the very loop that's keeping you awake. So you want to look at the CEO of your brain that called the prefrontal cortex, the area that regulates your rational thoughts and your decision making, because it gets overridden by the amygdala, that fear center, that center that looks at threats. So your brain is no longer preparing for sleep. It's scanning for danger and preparing for danger. So sleep doesn't come from control. It actually comes from allowing it, from surrendering, enjoyment. So the shift needs to be here from I need to sleep or I'll fall apart to it's time to rest and I trust my body and my body knows how to do this. So you have to teach your brain that bed is a place of safety and security, not strategy. This is where the mindful versus brainful lens comes in. The brainful self keeps solving problems at 10 p.m. The mindful self says, now it's time to feel calm. So that's pillar number 1. Do you see how much we spent on pillar number 1, even though the symptom is 4 and 5? So this is where we're going into pillar number 1. Now, diet and nutrition. Avoid caffeine afternoon. Watch your alcohol intake because that interrupts your REM sleep, your deep sleep. Stabilize your blood sugars in the evening because those sugars can actually increase at nighttime by eating sugars at night or taking late night snacks where sugar can interrupt your sleep. And we're going to get into that later on. So sleep isn't just about laying down. It's a biological program that relies on both timing and biochemistry. 2 of the most important molecules in sleep is melatonin, which we talked about, and adenosine. So melatonin is a hormone. It's produced by the pineal gland. It's response to darkness, and it's not sedative. It doesn't make you sleep. What it does is it signals the brain that it's time to prepare for rest. Think of melatonin as that starter pistol in a race. It doesn't run the race, but it tells the body when to begin. That's all it does. So that's why if you're taking a lot of melatonin right before your sleep, that is not the time. So the problem is that synthetic melatonin is overused and it's misdosed. So people are taking too much of it, which I talked about. So for this particular patient, I told to avoid the melatonin and to introduce melatonin if the lifestyle and modifications and all of those pillars were not helping, then I would add that as part of his program. Because higher doses could actually disrupt the circadian rhythm or even lead to some grogginess and some hormonal imbalances during the day. So this is why in clinical practice, if I recommended melatonin at all, I suggest using very low dose and only short term, just for shift work or jet lag, but not as a sleeping aid. So if we mapped out circadian rhythm that's related to shift work or some people that travel and they have trouble sleeping at night, if they're going from East Coast to West Coast or vice versa, we can add melatonin for that. And we're going to get into those videos. But I'm using this particular patient to see how I counsel the patient and my approach. So the other molecule is adenosine. Adenosine builds up in the brain throughout the day as your byproduct of energy. So the longer you're awake, the more adenosine accumulates, increasing your sleep pressure, the natural urge to fall asleep. So here's the catch. What does caffeine do? Caffeine blocks adenosine. It blocks the receptors. That's how it keeps you alert. It also means that drinking caffeine too late in the day blunts the brain's natural signal to rest. Not just by delaying sleep, but lowering sleep quality and shortening those deep sleep stages. So if you're wired at night and you can't fall asleep or you feel unrested even after sleeping, look at your caffeine intake. Look at the melatonin that's in rhythm. Most of the time isn't a pill. So if you're going to see the doctor, and a lot of doctors prescribe pills, how many doctors ask you the questions that I do? Do you see all of these questions? Because insomnia is a symptom in this case. It's all it is. And we need to get into understanding why you're not sleeping at night, not just looking at the box of I can't sleep at night. Exercise is pillar number 3. So here's what exercise does for your sleep. We're going to get into it later on. Number 1, it builds adenosine naturally. It regulates, number 2, circadian rhythm. Number 3, it lowers your sympathetic nervous system overall, not if you exercise too late, because that will elevate it in the short term. Number 3, it lowers your sympathetic nervous system. Again, too late at night, that could interfere, but overall, it actually calms that sympathetic nervous system. Number 4, it improves your REM and deep sleep quality. And number 5, it reduces insomnia and your anxiety symptoms. So here's the nuance. Intense workouts right before bed may raise your body temperature and adrenaline, which can delay your sleep. So it's better to exercise early in the day. But if you're somebody that doesn't have time, early afternoon or later afternoon, and avoid in the evening. So it allows your nervous system to settle before bedtime. So the message is movement during the day sets up stillness at night. So movement during the day sets up stillness at nighttime. So for patients like this one who feel stuck, they feel stressed and wired, adding 20 to 30 minutes of movement can shift the whole entire brain and body chemistry, and it can invite your sleep rather than chase it. So exercise is not optional for sleep. It's your brain's preparation ritual. It's got to be part of that ritual. So when your body moves with rhythm, your mind learns to rest in rhythm too. So pillar number 4 is sleep. So again, this is the core pillar here. We're going to get into sleep and sleep hygiene and all of those videos later on, but we're going to talk about in this case. So in this case, I spent most of my time on pillar number 1. So maintaining a fixed wake up time. Number 2, get sunlight in the morning, dark at night, avoid screens, create a wind down ritual, keep that room in a cool environment, dark environment, and free in distraction. So sleep hygiene is very important. And we're going to go into that in a lot of the other videos. And number 5 is physical health. Again, physical health is sleep influences everything. It helps your immune system, it helps your metabolism, it helps your mood, and it helps decrease your level of pain. It's not optional here. Sleep is life support for the brain. So what do I close here, and how did I approach this patient? The patient thought he was broken, that something was wrong with his brain. Maybe he had a condition that was affecting him. I was telling him exactly what I'm telling you now. Your brain is doing exactly what your habits and what you trained your brain to do. It's in full training mode. The thing is, you're wired to expect stress at night. But the good news is you can train to expect rest. That expectation is going to be rest and relaxation because your brain, mind, and body deserve it. You're not an insomniac. Do not identify yourself as that. You're someone that has trouble falling asleep at nighttime because of that mindset, which we can change. So you're a person, your mind is overstimulated and your brain has developed a bad or maladaptive habit. That habit can change with education, with knowledge, with repetition, and changing your identity from an insomniac of somebody that can't sleep because he always labeled as an insomniac because you labeled yourself as a bad sleeper since you were young. Your brain is neuroplastic. It can change over time. Sleep is not a reward. It's not a battle. It's a gift. It's relaxation. It's enjoyment. You want to jump on that bed knowing that you deserve it. Your mind has the power to receive it. If this has helped you, subscribe to more videos on your brain and mind health from a neurological perspective. Comment below, what's your biggest struggle with sleep? What's affecting you the most with sleep? What do you want to hear about sleep? What's preventing you from sleep? What are the neurological advantages of sleep? I can go all of that. If this video has provided you help, please share it with a friend or somebody that needs this video to help them. Please click on share. Thank you very much.